Well, it may sound a little cliche, but a good smile can really brighten up a room. Researchers have actually found that smiling can dramatically improve your mood. So don't let missing teeth or wearing dentures cause you to hide your smile. You may be a candidate for a certain type of procedure. We're going to get to that, but first let's meet the doctor who is here today, Dr. Matthew Nawrocki. He's a prosthodontist, and he... You know what? It's one of those days. It really is. How are you doing, Dr. Nawrocki?
I'm doing well.
Thanks so much for being here. Let's get into what that procedure is in just a second. But first, before we do that, let's show some of the before and after photos of people who have actually come into your practice and had this procedure done.
Yep.
And the before and afters are just simply amazing. So let's put those up, and you tell what the challenges were when you saw these patients.
Basically, the pictures kind of speak for themselves, but these patients had lots of failing restorations. Some of them had pain, some of them did not necessarily had that, but they were just stuck in the rut of treating, retreating, multiple root canals, crowns, and just really just wanted to be done with it, wanted to be out of pain, and wanted to have something that looked and functioned well all at the same time.
I can't imagine multiple root canals.
Yep.
I mean, if you've ever had one, that's bad enough,
Yeah.
but having to do that over and over, why would you do just poor teeth health? I mean, not properly taking care of them? Or?
Various reasons. Just like a tooth that has a filling or a crown or something can fail and go bad because of bacteria, so too can a root canal. And whether it's a misaligned or misfitting restoration, i.e. the crown or what have you, the filling or the root canal for one reason or other wasn't done well enough, it can re-flare up, and sometimes that can cause pain and discomfort. But oftentimes major problems or dental problems don't manifest in pain. So the absence of pain doesn't necessarily mean...
Okay, so that's not the underlying symptom.
Many of these patients report chronic abscesses and things hurt, and they actually tell us once the teeth come out, they just feel better. We haven't even finished the case, and they just feel better. But yeah, the presence or absence of pain are sometimes on these people. They just simply want to be done with treatment. They're tired of constant rut of treatment, retreatment. But there's also some people that come to us and say, you know what, I think I'm probably just going to lose all my teeth. These are good options. And sometimes we tell them no, with some minor things and maybe just a couple little veneers or something pretty minor, you're in good shape, and just getting you on a regimen there.
So there are multiple scales. So you can do something as simple as just a few aesthetic approaches with veneers, like you said, or the Hybridge. Now that's the procedure that we saw with a lot of the patients in the before and afters a second ago. That is when you go in and you completely take out the teeth, both top and bottom, or...
Either if you're presenting to us, you come to the office and you have teeth that need to be taken out, whether it's the top and or bottom jaw, we can do that. Or some people are in dentures and they're just, dentures move around, they hurt, they cause discomfort, particularly bottom ones.
So this is a permanent option then?
This is permanent. You don't take it out. Your dentist
painful. Can I just say that? Obviously you're going to...
It's pretty manageable.
Okay.
It's generally, if you can tolerate having a tooth taken out, and most of these patients have had one or several taken out, implants generally are not as uncomfortable as taking a tooth out. So with my partner, Dr. Aguila, and him being a periodontist, he can manage your discomfort. It's very manageable. It's mild to moderate at worst, generally.
So this is really for complex dental problems, as we mentioned.
It is. It can solve a lot of complex dental needs.
Okay, and what about maintenance? I know something like this. I know, and I have a relative that wears dentures, and they're very time-consuming to make sure that you're properly taking care of them. What about the maintenance for something like what we just saw?
It's very similar to your natural teeth. So just like in your natural teeth, we generally recommend every 3 to 4 months coming in. Some people it's 6 months. But so too with this. You come in, at least in this type of prosthesis, we recommend every 3 to 4 months. A little bit different tools to use than if you had your natural teeth, but our team of hygienists go over all the tricks of the trade. They show you how to get in all the areas, keep them clean, how you can incorporate things like a water pick. But you maintain them similar to you would your natural teeth. Coming to see the hygienist every 3 to 4 months to keep them clean. Yeah. And it's not the time-consuming, take your dentures out and set them in the glass at night. These are permanent. These are as close as we can get to your natural teeth with obviously not being your natural teeth.
And who's a candidate? I mean, I'm assuming this is an older demographic, or what are you looking for?
We have a lot of the baby boomer generations just because they're starting to get to that time in their life where the kids are moved on, they're out of the house, they've graduated from college, things like that, and they can start investing resources and time and money to themselves. They're living longer, they're healthier, they're more active. But we also treat an older population, the geriatric population, or even a younger one. Anyone who's afflicted with chronic dental pain or dental treatment and wants to kind of get out of this, this may be an option for you. So the oldest patient we've done this on to date is 92. The youngest patients on in some occasions are in their 40s. But it certainly can be
Yeah,
anyone in
across the
between.
gamut.
Yeah.
Well, we're almost out of time. We have about 10 seconds left, but tell us quickly about the seminar that you have.
So the best thing if you want to know what your options are, come to our free monthly seminars. We have one next Wednesday, March 26th at 6:30 at our Jacksonville location. And we can go over different and various options that may or may not apply specifically to you. And we can always follow this up with your individual consultation. Or if you're wanting to, if you kind of know, you kind of want to proceed with something in mind, schedule an individual consultation. We can answer those questions as well.
Okay, thank you so much, Dr. Nawrocki.
All
We
right.
appreciate you being here as always, and thanks so much to Jacksonville Dental Specialists for coming on and sponsoring this segment. To learn more about your dental implant options, you can visit their seminar, which again was there on your screen. You can call the number to get more information, 904-460-4201, or visit jacksonvillehybridge.com.